definitely we are worrying for the AMR. And for that, the first thing is first, when there is non-necessary, we should avoid the antibiotic. So while selecting the empirical antibiotic choice, we have to first, with the clinical pictures and the histories, we need to put forward that there is most likely a bacterial infections, should not be a viral. Then we should start with the antibiotic empirically, and the antibiotic choice depends on the clinical situation of the patient also, and the suspected site of the infection. So if you think it is a bacterial infections and there is a sepsis in going towards the septic shock, the first thing, the antibiotic should be administered within a first half an hour of contact point. And it should be broad enough so to that it should cover the suspected organisms or potential organisms. And your antibiotic should also penetrate the organ which is suspected affected. So if I'm treating the pneumonia, and which is most likely a bacterial pneumonia, I should choose the antibiotic which penetrate the lungs tissues also. And at the same time, it covers all pathogens which likely to cause the pneumonia. And before giving antibiotic, I should send the culture and sensitivity, so that as soon as I get the culture and sensitivity, I can step down or reduce my spectrum, so that the emergence of new resistance can be minimized. This is a major things while selecting the antibiotic in a septic shock, because most of the patients who are, when we are dealing with the sepsis, they have the larger or lesser number of acute kidney injuries are always there. So we need to consider the acute kidney injury, but at the same time we need to hit hard also. We cannot just reduce the dose according to the guidelines of creatine clearance, because at that juncture, the creatine clearance and the drug side effects, we need to balance both. We need to treat the cause also, because your acute kidney injury is because of the sepsis, and at the same time, we need not to aggravate the acute kidney injury which is already setting in. So we can use, like right now we have the options, like we need to choose the antibiotic which are renally safe, and if we don't have choice, like in some of the CREs or multi-drug resistance and infections, where we can definitely, we are thankful to the pharma companies which are coming up with research like supramolecular colloidal solutions, avibactams, varobactam, which cannot affect or reduce the efficacy of the antibiotic, and at the same time prevent the kidney also. And we require much more research for that purpose also. Some of the biomarkers also can be helpful in these situations to detect the early injuries in such organs, and so that the precautions can be taken in that context as early as possible before the end organ damage occurs. And yes, while dealing with the sepsis, we cannot forget the hemodynamics. We need to maintain the hemodynamics to prevent all this multi-organ disease or damage.
Issued in public interest by Plea Charitable Trust, an initiative of Venus Remedies Limited.